Hello everyone, and welcome to our student-led discussion on nature-based interventions. My name is Lauren Boutz, and this presentation was created together with Kaitlyn Martinez and Trinity Puno. Today, we'll explore the historical roots of nature-based interventions, discuss how positive mental well-being can be measured, examine some of the conceptual and methodological challenges in this field, review evidence from White and colleagues' 2019 study, and consider future implications for public health practice and research. As interest in prevention and positive mental health continues to grow, nature-based interventions have emerged as a promising approach for supporting health, social connectedness, and overall well-being. So with that, let's begin by looking at the historical roots of nature-based interventions.
So to kind of lay the foundation for the reading, we're just going to go over some historical roots of nature-based interventions, starting off with ancient practices. Nature-based interventions weren't exactly a new idea. According to Zhu's qualitative research called History and Evolution of the Healing Gardens, the roots of nature-based interventions can be traced all the way back to ancient Egyptian, Greek, and Roman civilizations. These societies intentionally incorporate natural environments into healing practices. Often they built their temples and sanctuaries near fresh water, trees, gardens, and overall just an area with a very scenic landscape. They believed the nature was to promote their physical and mental and spiritual well-being, and providing this sense of peace and restoration and this connection to the divine. And moving on to moral treatment. By the early 1800s, these ideas became more integrated into healthcare through the philosophy of moral treatment. Asylums began incorporating gardens within them, walking paths, and outdoor recreation as part of their patient care because they believed that the fresh air and exercise and just overall contact with nature would be supporting in their recovery. Patients were also encouraged to engage in meaningful work, recreation, and structured daily routines. This marked one of the first organized efforts to intentionally use natural environments as part of healthcare and mental health treatment. And moving on into the formalization in research, following World War I, nature-based interventions became more formalized as soldiers were experiencing shell shock, otherwise known as PTSD. And they started participating in these horticultural activities like gardening as part of their rehabilitation. This type of activity provided this sense of structure and support within their lives and just an opportunity to focus on the growth and recovery of something rather than a traumatic experience. So over time, these practices evolved more into organized therapeutic programs and helped establish the foundation for modern horticultural therapy. And then in 1992, Theodore Roszak published The Voice of Earth, which there's a picture of the book cover to the right, which helped establish the field of eco-psychology. Roszak argued that human well-being is closely connected to our relationship with nature, and that disconnection from the natural can contribute to psychological distress. More about his work and his theoretical explanation on why nature may support mental health. Around the same time, researchers also started formally studying nature-based interventions, examining how they could affect stress, anxiety, depression, PTSD recovery, and overall just well-being. This shift helped more nature-based interventions from historical practice into an evidence-based field of study.
To evaluate the impact of nature-based interventions, researchers need reliable and validated ways to measure positive mental health outcomes. One well-established tool is the Warwick-Edinburgh Mental Health Wellbeing Scale, or WEM-WBS. This self-report instrument was developed to assess positive mental well-being rather than focusing only on symptoms or illness. The WEM-WBS reflects both hedonic and eudaimonic aspects of well-being. Hedonic well-being includes positive emotions and life satisfaction, while eudaimonic well-being focuses on meaning, purpose, and positive functioning. Some examples of indicators included in the scale are feeling optimistic about the future, feeling useful, feeling relaxed, thinking clearly, and feeling close to other people. While White and colleagues did not directly use the WEM WBS in their study, the outcomes they examined, including subjective well-being and self-rated health, reflect related dimensions that are commonly studied in positive mental health research. Because the WEM WBS is reliable, valid, and sensitive to change, it is considered a well-established measurement tool and could be used in future research to evaluate the effects of nature-based interventions and better understand how experiences in natural environments influence mental well-being over time.
So now going into the conceptual and measurement challenges, while this study did find that spending at least 120 minutes per week in nature is associated with better health and well-being, the authors also mentioned their limitations and how they should be addressed before any nature exposure guidelines become actually official. So going into the first challenge, causation versus correlation, although the study found that individuals who spend at least 120 minutes per week in nature are more likely to report good health and higher well-being, the study design can't exactly determine whether nature exposure actually is caused because of those outcomes. Because the data was observational and it was collected at a single point in time, it is possible that healthier and happier individuals are simply more likely to spend time outdoors, but still emphasizing a need for longitudinal and intervention studies are better to understand a more cause and effect relationship. The second challenge and limitation is defining what exactly counts as nature exposure. In this study, exposure was measured as recreational time spent in natural environments during the previous week. However, in other studies that we were looking at, one by Jimenez and Labib et al., highlighting researchers may use different measures of exposure. Some studies focus on time spent outdoors, while others examine proximity to green space, access to parks, or participation in nature-based activities. Labib et al. Had put a little graph on the top right. Rather than viewing nature as just a single concept, this figure illustrates multiple forms of exposure, including neighborhood greenness, access to public natural areas, window views of nature, visits to outdoor natural spaces, private gardening, indoor plants, and even a virtual nature experience. This figure also shows that these different types of exposure may influence a wide range of outcomes, including mental health, well-being, physical activity, and overall health. Because nature exposure can take so many forms, researchers still lack a standardized definition, making it difficult to compare studies and determine what aspect of nature really is the most beneficial. The third challenge and limitation, kind of building off the second one, is the variation in environmental quality. According to Shrestha et al., nature-based interventions can occur across a wide variety of settings, like forests, parks, gardens, rivers, lakes, and coastal environments. The authors distinguish between green spaces, which are vegetation-based environments, like forests and parks, and then there's blue spaces, which is water-based environments, like rivers, lakes, and oceans. These environments provide different sensory experiences, hear different things, can touch different things, and may influence health through different mechanisms. So as Shrestha et al. Kind of emphasize in this study, the factors such as biodiversity, accessibility, and environmental quality can influence the effectiveness of nature-based interventions. As a result, 120 minutes in a biodiverse forest may not be the same experience as spending 120 minutes per se in a park or something. And then finally, individual differences in experience can create another conceptual challenge. Again, still going off the Shrestha et al., they describe nature-based interventions as part of a complex system, which is also influenced by cultural, social, and personal factors. They suggest that engagement, involvement, and just overall meaning on how individuals shape their own experience and kind of shapes how they benefit from nature as well. For example, one person may find gardening highly restorative, while another can see that hiking is really enjoyable for them, or spending time near water, just a lot more, they feel very relaxed in that way. So personal preferences, previous experience, cultural background, all of that stuff can play a big influence on outcomes. This means that the same amount of nature exposure may not provide the same benefits for every individual. All in all, together these challenges demonstrate that researchers are still working to understand not only how much nature people need, but also what type of nature is most beneficial and under what conditions and for exactly whom.
That brings us to the White et al. 2019 study, which serves as a pretty compelling piece of evidence supporting nature exposure, but with some important caveats. The study analyzed data from nearly 20,000 adults across England, which is a large nationally representative sample, and it found that people who spend at least 120 minutes per week in nature had 59% greater odds of reporting good health and 23% greater odds of reporting high subjective well-being. Again, these are self-reported data compared to those who reported either 0 minutes of time in nature per week, or those who did report some time in nature per week, but still less than the 120 minutes. According to their findings, there was no significant difference between spending less than 120 minutes and spending 0 minutes in nature. So focusing on those who did spend at least 120 minutes per week in nature, they found a kind of threshold or a sweet spot where if someone did get 120 minutes per week, they started to see improvements all the way up to 200 to 300 minutes per week. That's where improvements began to peak and plateau. There were no further improvements from there. So this presents, again, that threshold or that sweet spot between the 120 minute and 200 to 300 minute per week mark. The authors are pretty cautious around the strength of evidence brought on by this threshold because the data is self-reported, so there are some biases to account for in how people are incrementing their time, how much clustering there might be around a certain time frame, specifically around the 2-hour mark, and they are also warranting further investigation on the fact that there is no further gain from the longer amount of time that someone spends in nature past that 200 to 300 minute mark. That said, though, the findings were observed across a variety of populations, including older adults, people with chronic health conditions, people in urban and rural areas, and the association remained even after controlling for numerous potential confounding variables like age, sex, socioeconomic status, employment status, neighborhood green space, physical activity, and area deprivation, or parameters of aspects such as unemployment and crime, again, education levels, access to housing and services, etc. And it also didn't seem to matter whether people accumulated their nature exposure through one long visit or several shorter visits throughout the week. The improvements were pretty similar in that aspect. And so the study does provide strong evidence that spending time in nature is associated with improved health and well-being, but it doesn't fully explain why this happens. It doesn't really go into the mechanisms linking nature exposure to well-being or vice versa. And that brings us into our next section. Now, we've discussed the pretty clear relationship between nature exposure and improvements to health and well-being. But why does nature have this impact? How does it happen? The Level et al. 2019 article goes deeper into how nature-based activities promote psychosocial benefits, and you'll recognize the figure on the right from the article as well as from the past lecture, which explores the psychosocial pathways through which nature improves well-being. And this includes increasing social connectedness, reducing stress and mental fatigue, establishing a sense of purpose and direction, which contributes to self-efficacy, and encouraging physical activity, of course. But there are other theories that we've learned about that provide additional explanations, like the stress reduction theory. which proposes that natural environments kind of remove stressful components and instead incorporate positive emotional and physiological responses. And this reduces overall stress. So, for example, if you have someone who's experiencing anxiety, tension, and overwhelm from their daily life, say they live in an urban environment where the constant sights, sounds, smells of the city are activating their senses, and on top of that, they have complex needs and responsibilities they have to address in their daily life. If you place them into a natural environment where there's a physical separation from their daily life in an urban environment, and there's so much of a difference between that and the natural environment that their stress is reduced. And then the attention restoration theory takes it a little bit further, I would say, where not only is there a kind of reset, but there is an added healing component by being in nature. But this is more specific to someone's attention and focus. So say someone is so overwhelmed and their mental load is so high that they've reached maximum capacity. They may not be able to focus as well as they would if their mental load were not perceived to be as full, or if they weren't feeling so overwhelmed. So what nature can do in this is provide a kind of soft fascination, quote unquote. And this soft fascination occurs by watching the waves on a beach or experiencing a fresh breeze. I kind of see it as the embodiment of stopping to smell the flowers, right? There is a soft fascination and in these things where they grab your attention. The simplicity of nature grabs your attention in an effortless way. And this is inherently restorative and healing to someone, specifically for their mental and cognitive load. And then the biophilia hypothesis is really based in an evolutionary perspective, right? As we learned from this perspective, because humans are part of nature ourselves and we have evolved with nature, we have an innate disposition to want to seek out and connect with nature. So of course, nature is going to have an impact and we are going to benefit from it. With all of these points in mind, these explanations are not mutually exclusive. Actually, something interesting is that the White et al. Study found that the association between nature exposure and well-being remained and was consistent even after controlling for physical activity, if we remember that. So this suggests that exercise on its own does not fully explain the observed benefits. And so we raise an important question about whether the benefits stem mostly from social experiences in nature, the psychological restoration, or if it's an innate connection to nature, or maybe a combination of these things that, again, contribute to those benefits.
These findings suggest that nature-based interventions hold significant potential to support mental health and well-being across diverse individuals and communities. One important implication is the need to expand access and promote equity. Not all communities have the same opportunities to access safe and supportive green spaces. Future efforts should consider the structural and environmental barriers that may influence access to nature and work to ensure that opportunities are inclusive and responsive to community needs. These findings also have implications for public health practice and policy. Nature-based approaches could be incorporated into schools, workplaces, healthcare settings, and community programs. Examples include park prescriptions, community walking groups, and other forms of nature-based social prescribing. Lavelle and colleagues describe how these approaches may also strengthen social connectedness and help address social isolation by connecting people with meaningful activities and community resources. Future research is needed to better understand which components of nature-based interventions are most effective, how benefits may differ across populations and settings, and how positive outcomes can be measured over time using rigorous and culturally responsive approaches. Finally, long-term success will require collaboration across sectors, public health professionals, healthcare systems, urban planners, educators, community organizations, and community members all have important roles in creating and sustaining environments that support health and well-being. Overall, investing in access to nature represents an investment in the health and well-being of individuals, communities, and future generations. Here are our discussion questions, which will be posted online. And here are our references. Thank you for watching.